Struggling with mental health or confused by the system? With over 2 decades in psychiatry and mental health, I'm here to break it down, bust myths, and bring hope. Let's talk mental health. Real, honest, and empowering.
Hello, Clarity fam. Welcome back. I know last week I mentioned we will be talking about stress today, but something in my spirit pushed me to do this topic instead. Today we will be talking about postpartum depression, commonly known as PPD in simple terms. So we will be using PPD to refer to postpartum depression as I go along. So that's what we'll be talking about today in this episode of the Mental Clarity Program. Postpartum depression and also postpartum psychosis, because sometimes they go together. Sometimes people have the depression and the psychosis at the same time. So we will be discussing both of them. We'll discuss what both of them are, why they happen, how families can recognize the warning signs early. We'll also discuss the historical case of Andrea Yates in a responsible educational way. I know probably some of you remember that situation with Andrea Yates and how serious untreated postpartum mental illness can affect one. So in this discussion, we will discuss what postpartum depression feels like, what it really feels like, the hormonal and the emotional causes, differences between baby blues and PPD. We'll also talk about the early screening and treatment options for PPD. We're going to discuss when the symptoms become a medical emergency, or how to know when the symptoms become a medical emergency. We're going to talk about how partners, family, and friends can help. If you or someone you know is in any kind of crisis, call or text 988 in the US for free, confidential, 24/7 help. As well, you know to call 911 or proceed to the nearest hospital. Now, if outside of the US, visit findahelpline.com to locate international hotlines. I wouldn't know in various countries what their hotlines are. So here's a disclaimer for this program. This content is for educational purposes only, and it is not by any way a substitute for professional medical advice, diagnosis, or treatment. I'm just giving you information, knowledge. It's for pure educational purposes, okay? So there's some issues in mental health that touch my soul in a very special way, and this is one of them. Every time I speak about some topics, I feel deeply emotional, reflective, and deeply moved because I know the pain it causes, and I also know the fact that with awareness and support, recovery is possible. So please like, subscribe, and share this video because we all know someone who is pregnant, has recently had a baby, or plans to have one in the future. This information could truly help save lives. Life of mother and baby. What we'll cover, we're going to be talking about what postpartum depression is, why it happens, what it feels like, how to recognize the symptoms if you do have it or recognize those symptoms in anybody, what the treatments look like, and when to seek immediate help. Those are the things that we're going to be looking at today. So let's talk about what PPD, postpartum depression, is. Postpartum depression, PPD, is a form of major depressive disorder that happens after childbirth. According to the DSM-5, which I've told you about, is the book that we use, DSM-5 tells us that it's diagnosed as major depressive disorder with peripartum onset, meaning it can begin during pregnancy or within 4 weeks after delivery. However, in real life, we know Symptoms can appear anytime in the first year after birth. I've seen it a lot. It can appear anytime after birth. It doesn't discriminate either. It can happen to women of any background, any age, any race, any financial status. It doesn't pick and choose. Doesn't. We're going to be looking at one case that changed awareness. Let's look at one story that brought postpartum mental illness into the national spotlight. 2001, Andrea Yates, a mother of 5, experienced a severe episode of postpartum psychosis that led to the tragic deaths of her children. Her case became one of the most well-known examples of how devastating untreated postpartum mental illness can be. I remember that case like it was yesterday. At the time, she was suffering from profound depression and psychosis. Andrea Yates had been hospitalized multiple times. She was also prescribed medication, but her condition worsened after each pregnancy. After each baby, her situation got worse. Her case was first handled through the criminal justice system, but then later on, after appeal, it went on for a long time, the courts recognized the severity of her psychiatric illness. And after a while, she was now committed to a state mental health facility. And there she still is. She continues to receive treatment and care. Now, this tragedy of Andrea Yates brought worldwide attention to postpartum depression and psychosis, which could happen at the same time. Before then, this condition of PPD had not been really widely understood by people. But hey, it did start an ongoing conversation about the need for early screening. Do we have accessible care? And maybe even compassion for mothers struggling after they gave birth. Why does this matter? It matters every day because we see heartbreaking stories about mothers all the time who feel disconnected, fearful, and overwhelmed after giving birth. But that doesn't mean that every situation that is difficult like that involves postpartum depression or psychosis. But many of them are tied to untreated mental health conditions that could also have been recognized earlier in the pregnancy. So to make it clear, not every problem faced during pregnancy is depression or psychosis. As a mental health provider, I have personally treated patients with postpartum depression. I've seen it firsthand, how real it is, how painful it is, how frightening it can be, and how with the right help, recovery is absolutely possible. Why does postpartum depression, why does it happen? Why does it happen to people? Well, it usually develops from a mix of biological, emotional, and social factors, including sudden hormonal changes after birth, like there's a sharp drop in progesterone and estrogen after birth. That's one of the reasons why that could happen. Also, sleep deprivation. We know how it is when you have a baby. They sleep when they want to. The emotional stress and all the new responsibilities that come with looking after a baby. The person might have already had a history of depression and anxiety, unresolved trauma that someone could have had, lack of support or not wanting to ask for help. Could be all these reasons. Financial stress, a difficult childbirth. It could be a domestic conflict. It could be a bunch of anything, all of them together, or a few of them together. I can tell you from experience that caring for a newborn is exhausting, even with help. There's a lack of sleep. There's you trying to physically recover. There's a feeding schedules. There's a baby crying. And then there's this pressure to do everything perfectly. And this can lead to burnout. But having emotional and physical support makes all the difference. So the legacy of this Yates case, I had to pick this story because that really is something that would deepen the understanding. But her case forced both the public and the medical communities to look closely at how we view maternal mental health. What did it do? It led to greater awareness of postpartum depression and also psychosis. And for us to know that psychosis that comes with postpartum is actually a medical emergency. It's not a character flaw. It's not. More discussions about how the legal system handles these kind of cases involving serious mental illness became to be a thing. There became a push for earlier screening and intervention for new mothers. So this case did actually help a lot. What does it feel like? Postpartum depression. It's a lot more than what you would feel if you have baby blues. Baby blues is short-term mood changes but they usually resolve within a few weeks, maybe a couple of weeks. Postpartum depression, on the other hand, lasts longer, feels a lot more heavier, and can interfere with the mother's ability to actually look after her baby. That's the difference. So, what kind of symptoms do you experience as a mother that gave birth that has PPD? It's like a persistent sadness. There's anxiety, could be panic, it could be that feeling of emptiness. You lose interest to do things that you enjoy doing. Sometimes the appetite is gone. Sometimes the weight fluctuates. Could be more, it could be less. Difficulty sleeping, even sometimes when the baby's sleeping, that tells you something is wrong. Or even sleeping too much. Not even knowing when the baby wakes up and is crying. You end up sleeping too little or too much. Restlessness. Sometimes you feel slowed down. Sometimes you feel completely drained and helpless. You have low energy, constant fatigue. You feel guilt. Some days you feel worthless. Some days you feel like a horrible mom. I'm a bad mom. Sometimes you have trouble with focusing, remembering things, making decisions. Am I making the right decisions? Do I even decide at all? Thoughts of hopelessness. And then sometimes wishing that they weren't here. In rare and severe cases, a new mother may experience postpartum psychosis, which can cause confusion. They start having delusional thoughts, hallucinations, intrusive thoughts about something happening to herself or her baby. And when you have these kind of thoughts, with everything already going on with you, you can feel terrified and sometimes uncontrollable. And that's where the psychiatric emergencies come into play. That requires immediate medical attention. Some other experiences that you could have is sometimes you see these mothers that feel totally detached from their baby, struggling to bond. You have this baby now, you expected it, you wanted it for a while, and here's the baby. No bonding. Then you have the moms that will have constant worry about the baby's safety, getting irritable or angry towards others, crying spells. Sometimes you have women that will have overwhelming guilt or shame. How is it different from baby blues? Two different things. Sometimes people get them mixed up. Well, baby blues, begins within 1 to 2 weeks after birth. Doesn't last long. But PPD, anytime in the first year. So that's the difference. Baby blues doesn't last long, it goes away. With baby blues, you're able to function from day to day. It's a little different. But with PPD, your daily functioning is affected, and seriously. Baby blues resolves on its own. PPD requires treatment and support. But is there hope? Yes. For treatment and recovery, there is good news. The good news is that postpartum depression is treatable. Now, this treatment depends on how severe it is or how severe it has become. Therapy, we use CBT, which is called cognitive behavioral therapy. That works very well. And then we also use interpersonal therapy. That works too. And then we have medication. We do have antidepressants that we use, the ones that are safe for mothers, like breastfeeding mothers or when you're pregnant. We have support groups for new parents. We have the practical help, which is helping yourself, rest, nutrition, and getting help with daily tasks. Ask for help. So with early detection and consistent care, recovery is very likely if it's detected early. So when do you seek immediate help? Seek help right away if you or someone you know has thoughts of harming themselves or the baby, feels completely detached or unable to care for the baby. If they're experiencing hallucinations, getting very confused with things, or extremely agitated. So that will be the time to call 911 or 988 in the US, or go to the nearest emergency department, or reach out to a trusted healthcare professional immediately. Preferably, I would say call for help, because you might reach someone and not get them, and then, so I'd rather that you just call for help. This is my appeal to men. Men, let me tell you something real. Pregnancy and postpartum are not just physical. They are emotional, mental, and spiritual battles. When your partner is carrying or has just given birth to a baby, her body and mind are going through immense change. This is not the time to stand back. This is the time to step up. Support her with chores. Support her with the baby. Support her when the baby cries, when diapers need to be changed. Listen to her when she cries. And let me tell you, men, that's not weakness. That is actual strength. The way you care for her during this season will echo through your relationship, through your children's lives, and your family's future. Men, be her safe place. Men, be her anchor. That's what real men do. Real men. Final thoughts. Postpartum depression is not a character flaw. Postpartum depression is not weakness. It is not a medical condition. It is a condition that one deserves compassion, understanding, and prompt treatment. So let's keep talking about it. Let's keep supporting one another. Let's keep spreading awareness. If you or someone you know is struggling, please reach out for help. Like I said before, in the US, you can call or text 988 for free confidential support 24/7. So please, moms, you don't have to face this alone. Please subscribe and join the Clarity Fam for weekly conversations on mental health, for self-care, and emotional awareness. That's what I bring to you here. Thank you, Clarity Fam, for spending this time with me today, discussing this very important topic. Remember to like, share, subscribe, comment, send me an email. Let's continue to bring light and clarity to these hard parts, the hardest parts of mental health. Together. We're doing this together. And remember, I care for you. And I love you. Bye for now. And see you next Friday.
Thanks for spending time with me, Dr. Mary Opara. Don't miss next Friday for another powerful session. Until then, like, share, and subscribe to keep the conversation going. See you soon.